I'm Gina. I'm one of the physical therapists and clinical specialists at Aspen Aftercare, and I'm here with one of our patients, Valerie, who did our fast track program for a capsular contracture. So she's going to fill us in on just her experience here, any recommendations that she has, and just tell you a little bit so you feel more comfortable or can go ahead and call us, ask questions for your own case. So Valerie, you came to us how long ago?
Well, I think we started the end of February with my first treatment.
So tell us your history, when your surgery was and when you first noticed the changes in your breasts.
I had my surgery September 29th of 2023, and I noticed within 3 months that there was some hardness forming around the implant on my left breast.
Okay. And were you having pain at that time?
It was actually painful as well.
Okay, so some people can have pain with capsular contracture. Some people don't feel any pain, but they feel a firmness, or they see positional changes where one breast might move higher or just change in shape.
I was actually thinking that because that was where I had my rupture of my saline implant, that maybe it just was taking longer to heal and was taking longer to fall. So I didn't really think I had an issue at first. And then came to realize that it absolutely was going wrong.
Okay, so then you followed up with your surgeon, and then what led you to Aspen?
My surgeon basically just wanted me to try to do massages and, take milk thistle and vitamin E, and then just kind of watch and see. But I looked online, and they say that most things need to be addressed within 6 months if you want to have your best results from other alternative therapies, and I was trying to avoid another surgery. So then I found that there was an ultrasound therapy, and my doctor actually gave me the link to Aspen.
Okay, so she actually did a virtual. So for those of you that might be experiencing similar symptoms to Valerie, the next best thing is you can sign up, do a virtual. That's what we did with her. We made sure she was appropriate for treatment. And then she did, you have several options. If you're out of town, you can do a fast track where patients come in and they do the treatment like a Monday through Friday, 5 days, 10 treatments. We get great results. We have 90% success rate. So Valerie is part of that statistic. She has gone from a grade 3 to grade 1 in softness. And her positioning, she has dropped. Her breasts are now level, where when she started, her left breast was higher than the right, both at the bottom and the top. So tell us about your experience, any information that might be helpful to the viewers about your week here.
I just felt very comfortable with everyone here. Everyone was so friendly and helpful, and I felt like having results from something basically like physical therapy. You do some homework, but what physical therapy doesn't involve work at the facility and then at home as well. And just to have the results I've had and not have to have a surgery is just phenomenal. I can't think of, from where it was, where it felt like it was getting harder every day, to go to where it's soft and visibly, they look the same now. They
So
actually same to each other. They they look like twins.
Yeah. So if you had to rate your improvement in softness from the first day we saw you till now, so Valerie just did her 30-day follow-up. We do 10 treatment sessions, and you go home and you do homework where we have you do some exercises, wear a wrap, because you will continue to make improvements in the 30 days. So Valerie's here following up with her 30-day follow-up. So after the treatment, after the 30 days, where would you rate your improvement in softness, 0 to 100%?
I would say probably about 85.
Okay, perfect. So she has seen 85% improvement in softness. That also includes a lot of mobility, because when the breasts are firm, a lot of times they stick. It almost feels like they're sticking to the chest wall. So she has now softness and more mobility, looking like a natural breast. So.
And I had nerve pain all the time, and that
dissipated.
has subsided.
Great. So one of the first things when people come for treatment that they see is an improvement in softness and a decrease in pain. That's the two things that happen first. And then as we continue to stretch that capsule wall, then the dropping and the improvement in positioning happens. So any other advice or things you'd like them to know? Recommendations?
Just that I mean, if you can avoid surgery and get something done that is just on the exterior, I can't recommend it enough because it is a great alternative.
It's a conservative treatment where you don't have any, basically there's no recovery. You don't have to alter your life besides just coming for treatment, but you can continue to work out, you can continue to work. So the recovery, you don't have that post-surgical recovery, so it's a great alternative in that way.
And one other point, I know some people might think that, because I thought this, I'm going to wear that wrap, am I going to not be able to go anywhere? And I'm wearing it now, even with this top, which is probably lower than I would normally wear with it, but it's not showing. So you can do everything in your life wearing the wrap and doing it. So it's not like that's going to inhibit things, because I kind of thought that might at first. I was like, oh, darn, I have to wear that thing.
And it's only 30 days.
Right.
It makes
it's not
a huge
like
improvement.
you really, it's not like it alters your life at all. So.
Okay, great. Well, thank you for sharing. If you have any questions, if you're having these symptoms, please just reach out to us. We'd love to do a virtual to see if you'd be a good candidate. You can like us, subscribe down below, and we'd be happy to help you. Thank you. Thanks, Valerie.